Does lower blepharoplasty adjust Mylar bags, festoons? If not, how can they be removed? Lower, oh yes, it does. So a lower blepharoplasty, Zoe, is a bit more of a thing than an upper blepharoplasty, because you've got to be a bit careful, and it's a little bit more nuanced, a lower abdominoplasty than an upper. Can I say abdominoplasty? Blepharoplasty than an upper blepharoplasty. So an upper blepharoplasty is kind of like taking out the spare skin from here. So a lower blepharoplasty, got to be a little bit more careful. There's not quite as much spare skin in a lower abdominal. Sorry, I've been talking about abdominoplasties. A lower blepharoplasty. Full disclosure, I don't do blepharoplasty, so I'm just talking general terms here. So I don't want to make out as if I'm the Billy Big Time here, because I don't do blepharoplasty. But anyway, I can talk about it anyway. So a lower blepharoplasty will have a modest amount of skin removal and will often be addressing the fat pad, which is what you're talking about. So Mylar bags, so fat pad and festoons. You're talking maybe. So the problem with any kind of skin removal surgery, so if you have got festoons, if you have got a significant amount of spare skin, then more skin is needed to be removed, therefore scars are longer. So that's the thing to consider. So the scar for a lower blepharoplasty is kind of in the line of the eyelid, but the more skin that we've got to remove, then that can extend out onto the side of the cheek. So we try and hide the scar, but it does make the scar a little bit more obvious. And again, the more skin that you remove, the more risk of a doggy, a little bump at the end of the scar. So we try and make the scar, you get rid of the doggy by making the scar longer, but you obviously want the shortest scar, smallest doggy. So again, the more skin that is there to remove, the longer the scar. Often we look at the fat pad and we sometimes remove some fat, sometimes actually inject some fat, sometimes add fat into the lower eyelid. It is a bit more complicated and a little bit more nuanced, and is therefore requires a little bit more anesthetic. So it's not done under a local, it's either done under a GA or a local with sedation. So it's a bigger op, a lower blepharoplasty than an upper, and as you say, it often addresses more than just the skin. It often addresses the fat pad in the cheek area and in the lower eyelid area. So yes, so it does address those areas. And sometimes, I mean, it's I think it's got a little bit more of a kind of breadth of technique than an upper blepharoplasty. I think an upper blepharoplasty is more of a sort of standard what is done, and I think a lower blepharoplasty is a little bit more breadth of technique, and it could be considered kind of like a mid facelift. A lower, it's a lower blepharoplasty is often more than just like tightening a bit of skin in the lower eyelid. It often addresses the whole cheek subunit, so it often it might be described as a mid facelift, but it's just to because you do have to